Hello, everyone. My name is Joe Carranza. I'm the Benefits Administrator for the company. Today, we're going to get together to discuss open enrollment for plan year 2020. I'll be covering some information on open enrollment for 2020, as well as the platform that we'll be using for 2020. I will start the presentation, and then I will pass it off to Patrick Kirchum, who is with UHC, and he will cover some items concerning plan provisions and some other enhancements that we've done to make it a more friendlier user experience for our employees. So with that, I'll go ahead and get started. We will be having open enrollment beginning on Friday, November the 8th, and that will run through Friday, November the 22nd. This is for benefits that will commence on January the 1st of 2020. We will be utilizing SmartBin platform for enrollment. We had previously sent out an email telling our employees that we were going to be using ADP and that we were going to be starting open enrollment on November the 1st through the 15th. That has changed. So once again, open enrollment begins November the 8th and ends on November the 22nd. We're going to be having a passive enrollment just like we did last year. What that means is if you want to keep the same benefit level that you have today for 2020, no action is required on your part. So whatever benefits you have as of November 22nd, those benefits will carry over to plan year 2020. The only exception is if you're enrolled in our flexible spending account or our dependent care account and you want to continue to be a participant in those plans for 2020, then you will have to go into SmartBin and make an active election because those two benefits will not carry over into plan year 2020. I'll move on now to the second slide. So just a reminder on our log-on credentials for SmartBin. For all of us, the username will be MPFOC, followed by a 6-digit employee number. That employee number, you can find that under ADP, under your employment profile, or you can go to UltiPro and find your 6-digit numeric number as well. Some of you may have already created a SmartBin account in the past and probably set up a password. Come November the 8th, we're going to default that password for all of us to be the date of our birth. It'll be in an 8-digit format with no dashes and no slashes. So what will happen when you go into SmartBin, you'll put in your MPFOC followed by your employee number. Then you'll enter your date of birth in an 8-digit format. Once you do that, SmartBin will prompt you to change your password. So you'll have to change your password to continue the enrollment. Some really great news. All of our employee premiums will remain the same for the upcoming 2020 plan year. We'll continue with 24 deductions for the plan year. If you are an hourly employee, you will also have only 24 deductions. And for paychecks, just like we did this year, there'll be 2 paychecks that we don't withhold deductions. Those paychecks will be on May the 29th and October the 30th of 2020. I will now pass it off to Patrick Kirchum, who is with United Healthcare. He is their Senior Account Manager.
Thank you, Joe. Appreciate the opportunity to be here with you folks and help review your 2020 benefits. So we'll continue with the 2 plan options that you have for your medical benefits. There is a major change to the core plan. Again, this will take effect January 1st, 2020. So the new Choice EPO core plan will replace the current Choice Plus core plan. So we have bolded here for you in the presentation what the changes to the EPO plan. So none of the benefits will change, but the exception here to the EPO core plan is the removal of the out-of-network benefits. So that means you will not have out-of-network benefits except for emergency room services only. Okay, so that's important to remember, and we'll talk a little more in detail about that in a moment. Okay, so why did we make this switch? So in order to keep the premiums as is, there was a modification made, as I just mentioned, to the core plan, removing those out-of-network benefits. So in the past, Mission has historically had a high in-network utilization. So most of you, well, 98.7% of you, use in-network providers. So in order to keep the core plan without a rate increase for you, meaning money coming out of your paycheck, again, 98.7% of you use in-network providers under the core plan. So just a very small percentage of you will be affected by that. Some of those out-of-network providers may be an anesthesiologist, or maybe you just have a favorite family doctor that you've been using that is not contracted with United Healthcare. And under the current core plan, it still pays at the out-of-network rate under your out-of-network benefits. But again, as I mentioned, going forward, January 1st, 2020, the significant change to the core plan is removing the out-of-network benefit. So unless it's an emergency situation, and we'll talk a little bit more about that in detail, just to make sure that you're armed with the appropriate information. So how does United Healthcare determine a true emergency? So we have several bullet points here. At the end of the day, you pay for insurance for a reason. That's for peace of mind and to make sure that you're taken care of. So some of the examples I like to give as a true emergency is if I happen to get stung by a bee. Well, that's not really a true emergency. We do have levels of care. Most of us would know if we're allergic to a bee and are, maybe going to swell up or, have trouble breathing. Those of us, yes, that would be an emergency situation. But for the most part, probably a call to the virtual doctors to do a virtual visit. That's a free visit. That's going to save you time and money. And if you were to go to the emergency room for a bee sting, you're probably going to get a very large bill, and you're going to be very angry about that bill. So again, it's just about making those wise choices. If you happen to walk into a huge beehive and you're being chased by bees and you get attacked by hundreds of bees and have multiple stings, that to me would constitute an emergency. If, I'm playing sports with the kids and maybe I sprain my ankle, not an emergency, but if I fall and I break my bone and I see bone, that's an emergency. So again, it's just about utilizing your benefits correctly. So if you're going to continue to stay on the EPO plan, that core plan, going forward, January 1st, know that emergency room services will be covered. It doesn't matter if it's in or out of network. Emergency room services do not follow that logic. But if you have a favorite family doctor that you've been utilizing and they are out of network, you will not be able to use that provider if you stay on the core plan. If you do, none of the services will be covered. You'll have to pay 100% out of pocket, and none of that will count towards your deductible or out of pocket. Okay, so it's important that you keep that in mind. Again, that's just the big change, is just removing those out-of-network benefits, and there's only a small amount of you that are using out-of-network benefits currently under the core plan. So EPO options in emergency room situations. Okay, so as I've mentioned, that's emergency room services. This can be hospital-based or freestanding, and we know that some of those freestanding places, they get a little tricky with their signs. It's a business model, so we just need to be diligent. I always like to tell members that if an emergency room is attached to a hospital, there's going to be no trickery there. If you driving down the street and you see a Starbucks, a CVS, a Walgreens, and an emergency room on all four corners there, that's a freestanding facility. Okay, so you may get balanced bills for that service. Again, so just using emergency room situations for true emergencies. And as I mentioned earlier, we know our bodies best, and we should know if we need to go to the emergency room. Just trying to help arm you with information so that way you can make wise choices. Okay. Urgent care services would be an in-network in order to be covered. Okay, so urgent care facilities, they are not open 24 hours a day like an emergency room service. So most of them close by 11 p.m. They are open on the weekend. We do have a great mobile app, so you can find those facilities at your fingertips, and we'll talk about some of those, the mobile app here in a moment. I realize a lot of you are spread out throughout the nation, so understand, even though the EPO plan only has in-network benefits, if you're traveling in another state, whether it's for work or pleasure, you have an emergency room, you're going to be covered and you'll be taken care of, okay? But convenience care clinics, and those are like the ready clinics, you may see them when you're checking out at Walmart or maybe Walgreens, and they have those little clinics. That's like going to your primary care provider. They have extended hours, they're open on the weekends, and so that would be covered at a primary care copay. So again, those are in-network only, okay? So keep that in mind. You also have 24-hour nurses available to you through United Healthcare, and that's free of charge. So as I've mentioned, and we're trying to give you some tips on emergency situations, again, if you see bones sticking out from an accident you had, please don't try and call the nurses to ask them where to go to the nearest facility. Again, you know your body best, and yes, you should be going to the emergency room. But again, maybe you got stung by a bee, you're not allergic, but maybe the area where you got stung is starting to swell up, or it's red, or it's really irritated. Call those nurses. They're available 24/7. We also have an online chat feature with them on myuhc.com, so you don't even need to call them. But again, they can assist you finding the appropriate care and keeping you in network. Okay? So also you have Teledoc and Amwell and Doctor on Demand. Teledoc joined our virtual visit network January 1st of 2019. And all three of those providers you can find either on myuhc.com or through our mobile app. They're available 24/7, and it doesn't cost you anything to call. An example I like to give is folks that may have allergies. You know, maybe your allergies are acting up and you're on vacation. You know, nothing worse than having to try and find an urgent care facility or convenience care when you're on vacation. You can just do a virtual visit right from your phone with one of our virtual doctors, no copay. And if you need a prescription for that minor illness or those allergies that have kicked up, they'll find an in-network pharmacy located to wherever you're at, whether you're, again, on vacation or you're visiting family members, but they'll help you find an in-network pharmacy, fax in that prescription, and then you can go pick it up. So some of the way that our claims are paid currently, it is set up that way for your plan now, and it will continue in 2020. So related to both plans, your core and your buy-up plan, the non-par raffle, and I'll explain what that means in a moment, providers at in-network hospitals will be paid at 110% of Medicare, and the benefit is applied to the in-network benefit level. So you as the member receives in-network deductible and out-of-pocket credit. So raffle stands for hospital-based radiology, anesthesiologist, pathology, lab, and emergency room physicians. And again, that is the way that your plan is set up today, and in 2020 will continue the same way. Assistant surgeons are treated as in-network if the facility is in-network, and reimbursement is also at 110%. Same way that you currently have the plan set up today. So before I move on to the next slide, for my folks here in Texas, I realize we have people that will be listening to this throughout the nation, but in Texas, we do have a problem with emergency rooms popping up everywhere. So if you do happen to have a surgery or receive a balance bill from a provider, because you have these programs in place with us, they should not be sending you a balance bill. You do have rights as a consumer to loop in the Texas Department of Insurance. And the reason why I mentioned Texas Department of Insurance, again, some of you work from home and in other locations in other states, but Mission Pharmacal, that's where they're headquartered. So we follow Texas insurance laws. When you get an explanation of benefits, there is information about you reaching out to a mediation service that will help you for balance bills of $500 or more. Again, this doesn't happen often, but sometimes it does. And once the facility finds out how the plan is set up, they will generally leave you alone and not send you any more balance bills. But United Healthcare Customer Service, your Advocate for Me team, they can help you with those situations. So if you get those bills in the mail, please give us a call so that way we can help you. You already pay a lot for insurance. Your company provides a great benefit package. So I don't want you folks to have extra bills coming in when you're already paying for insurance. So please let us help you. All right. So how can you verify if a provider is in network? The UHC mobile app. And again, I'm going to talk about our app. There are some changes. As I mentioned, you can call United Healthcare Customer Service. That phone number is on the back of your medical ID card. And some of you like to keep a light wallet or a light purse and not keep too much stuff on you. So our mobile app has your medical ID card, dental, and vision. And there's an easy connect to United Healthcare option. So you wouldn't even need to look for your medical ID card to find that 800 number to give us a call. So a couple options there for you to reach us and asking the right question, okay? So if you're looking for a new provider or maybe you haven't had a family doctor for a while or you're new to the benefits, a new employee, and you want to know if they take United Healthcare insurance. Well, if you ask any provider or facility, do you take United Healthcare insurance? They're going to say yes. And then they're going to not be contracted with us, and then you'll receive a bill, and the plan may pay a portion of it. The key word is, are you contracted? Meaning they have a contract with us. They've negotiated rates of how much they're going to charge for services, okay? And you can also ask the simple question, are you in United Healthcare's network, okay? So just a couple things. But again, we'll talk about the mobile app and customer service. Again, if you need help finding a provider, but most of us have apps on our phone and can pretty much do those things for ourselves. So final note here before we move forward, UHC providers can drop off the network throughout the year. It is best to practice to verify with your providers when you set up your appointment, okay? So we negotiate contracts with multiple providers throughout the year. So just again, realize that your provider may be contracted today, but not tomorrow. When those things do happen and contracts expire with providers, and if we do not come to a negotiation, you will receive a letter from United Healthcare 60 days before that provider is terminated from our network, or sometimes providers choose to leave the network for whatever reason. So just know that there'll be some heads up for you, but again, just to arm you with information so that way you can be an informed consumer. All right. So the buy-up medical plan. This is the second option that you have, and there are no changes to this plan, okay? So that will still continue the way that it is set up today for January 1st, 2020. This buy-up plan is going to cost you a little more out of your paycheck because it does offer that out-of-network benefit. And again, the plan will pay lower. It's a 50-50, meaning you'll pay 50% of any charges, and the plan will pay 50%. Whereas if you choose in-network providers, it's an 80-20 and then co-pays under certain services. Your primary care, your physician, preventive care still covered at 100%. So, but this one gives you a little freedom of choice. Again, having that out-of-network benefit. And maybe for the 2% of the folks that do still utilize out-of-network benefits, if you're on the core plan today, you may want to think about moving over to the buy-up plan to still give you that option of out-of-network coverage. Okay? And as I mentioned, the second bullet point here, premiums are higher than the core plan, but offer an alternative if you want to continue seeing out-of-network providers. So what's new at United Healthcare? We have several things going on. So just again, want to arm you with information. As I mentioned earlier, Teladoc joined our virtual visit providers as of September 1st of 2019. We have a new United Healthcare app that's going to replace our Health for Me app. We have a Smart Direct Club benefit for you, and it's an enhancement, United Healthcare Hearing, and then some pharmacy benefits. No changes to your pharmacy benefits, but just want to let you know some of the things that we're doing behind the scenes for you folks. So Teladoc, as I mentioned, joined United Healthcare's virtual provider network September 1st of 2019. So that's going to give you 3 provider options now. Any of you that have used a virtual visit before, you can connect easily through the Health for Me mobile app. You do a face-to-face with the doctor. They're available 24/7. It is free. I know the example here with the asterisk does show $50 or less. That's for some of our other groups that may have a high deductible plan, but you folks have a copay plan. So again, that's a free visit with a real doctor, quick and convenient. I've actually used it myself, spent 10 minutes on the phone, had the prescription faxed in, and ran over there and picked up my prescription. So again, we have the 3 providers, Teladoc being the newest one to the virtual network, Amwell, and Doctor on Demand. You can actually select what provider you would like to use when you go through the Health for Me mobile app. Okay, so if it happens to be a busy Friday night or a Saturday night, and there's a lot of people trying to call in over the weekend or maybe late in the evening, again, it's available 24/7. There may be a little bit of a wait for you, and when you're in the app, it'll let you know if there's a wait. We call it the virtual waiting room. And you'll be able to select the provider that you want to talk to. There's a little bio on them. And as I mentioned, we are rolling out the United Healthcare mobile app. So you can see on the screen here on the left, right, the United Healthcare logo. For years that I've been out there visiting with you folks at corporate and at the plant, and I've been telling you to download the Health for Me mobile app. It can be a little confusing. At United Healthcare, we like to think we make things simple, but me as a consumer and an employee, I know that's not always true. But this is what you'll be looking for. And if you've used the Health for Me mobile app recently, there's actually a message that pops up and tells you about the United Healthcare mobile app. So both apps will run at the same time. So it's your choice if you want to download the United Healthcare mobile app and delete the Health for Me mobile app, or you can utilize both. It's going to have the same great information. But by the end of 2020, the Health for Me mobile app will go away. So again, if you haven't used the Health for Me mobile app, you haven't seen these messages. If you're a new employee or you haven't downloaded the Health for Me mobile app, just go ahead and download the United Healthcare mobile app at this point. Since you already have, if you have the Health for Me mobile app in myuhc.com and you've already registered, you have what we call a Health Safe ID. So the user ID and password that you would use for myuhc.com also matches your Health for Me mobile app password and user ID. You will use the same user ID and password for the Healthcare mobile app. Okay, just to alleviate confusion for you, trying to, remember another password. Lord knows we have enough passwords to remember. So we just want to make this easier for you folks to reach us, have information at your fingertips. As I mentioned, so with the addition with the United Healthcare mobile app, it was a branding thing. And I'm going to flip back to this screen. Again, look for that UHC logo. So that's what you'll see on your app store, depending on the device that you're using to download the mobile app. Also, you folks have our Real Appeal program, which is that virtual weight management program. So there's an app for that. If you're doing Rally, you folks have the gift card incentive program. We do biometric screenings. You folks can earn those gift cards. You're doing a great job earning that. Kudos to you. But there's an app for that as well. So with the introduction with the new United Healthcare mobile app is we're going to combine all that stuff. So you'll just go to one site, our United Healthcare mobile app, and you'll be able to access Rally and Real Appeal. So instead of you downloading more apps on your phone, you'll just have the United Healthcare app. And as United Healthcare moves forward, offering new products and services and other mobile apps, it will all filter right through the United Healthcare mobile app, making it a one-stop shop for you. So here's just a couple quick screenshots of virtual visits. So with Teladoc being introduced, that was the first provider we actually loaded onto the United Healthcare app. So if you've used the Health for Me mobile app and you've selected either Amwell or Doctor on Demand for your virtual visit, it would take you out of the app, the Health for Me mobile app. You would have to download either Doctor on Demand or Amwell and register on there. The that was frustrating. So again, as I just mentioned a few minutes ago, having a one-stop shop, the United Healthcare mobile app, that's how you'll access these virtual providers. You won't need to download a new app for these virtual providers. Just a couple more screenshots here to review with that. As I mentioned, Teladoc, Amwell, and Doctor on Demand. And you can screenshot here. You can select which one you would like to use. It does show, and this is just a sample here, so it does show an estimated cost of $49. Again, I can't emphasize enough that it is a free visit, 24/7, a great place to start if you're not sure about care. If you're seeing bone, as I mentioned earlier, because you had an accident, I want you to emergency room. But if you feel like you're great start with the virtual visit, it's free and you can get a prescription. Okay. There's another little snapshot. As I mentioned, you'll be doing a face-to-face with the doctor. So they'll see the Health for Me mobile app will sunset at the end of 2020. Your health will continue to make enhancements to the United Healthcare app. Okay, so just look for those updates. You'll have updates on there. One of the great features about the United Healthcare app that we did not have on the Health for Me mobile app is your pharmacy benefits. You could actually manage and review a refill from Health for Me, but now it will have your prescription drug list. So I know in the past it's been a little frustrating for members. You get a prescription from your doctor. Your doctor doesn't know if it's covered or it's not. They're just prescribing what they feel is right for you. You go to the pharmacy, drop off your prescription, you go to work, you work a long day, maybe you have to run some errands, you swing by the pharmacy at the end of the day to find out, oh, it's not covered. Yeah, it's very frustrating, and we realize that. So now your pharmacy benefits will be on your phone on the United Healthcare app, and so when you're at your doctor's office, you can also look to see, is this medication that the doctor just prescribing to me, is it covered? And I'm going to tell you about an enhancement, again, that we're doing with our medical providers. With your pharmacy benefits, looping them into the circle of what's covered under your plan. But we'll talk more about that in a moment. All right. And as I mentioned, again, this little house design here on the slide presentation. You have the United Healthcare mobile app, which is the core. All of these providers, some of our clients have Optum Bank with us, pharmacy benefits, the Teladoc services, all of the programs at the bottom. Again, making United Healthcare mobile app the one-stop shop for you, so you don't have to have all of these apps on your phone. If it looks like my phone, we probably have over 100 anyway, so it's nice that United Healthcare, and not only do I work there, but I am also a member as well. So yes, I'm tired of downloading other United Healthcare apps. I just want one. So I'm happy for this feature for all of us. All right. So great features. Again, if you've used the Health for Me mobile app now, you already know about some of the advantages that you have for searching for a provider. Again, as we mentioned, if you're going to continue with the core plan in January 2020 going forward, you're not going to have out-of-network benefits. So it's important that you continue to know if your provider is in network. Okay? So using that mobile app works with your GPS, so it will direct you accordingly. As I mentioned, your medical, dental, and vision ID card is on the mobile app, and you can view that. You can, if like I said earlier, some folks don't like to carry extra stuff in their purse or wallet, and this is a great way to show your provider, especially if you're going to a new facility. It does give you the feature to email or fax a copy of your ID card right there to that facility. But really what the provider is looking for is your member ID so they can verify your benefits. And then obviously on the back has our a billing address. They want to know where they're going to send their claim to. Okay, Smile Direct Club. So this is an enhancement that we have. It's just an extension of your dental benefit, and your dental plan does offer orthodontist services for eligible dependents 19 and under. So sorry for the adults here, but this is for the kiddos. So if your child needs braces, know that this is a feature for you. You've probably even seen some of the commercials. So it is a discounted program, and you can see on the slide here, you do this all from your home. So the dentist will send you this box here with the materials that you'll need. You'll do an impression for your child, send that in, and then they'll send you the Invisalign. There's some great discounts through this program as well. This information will be posted online, and it is also on myuhc.com. So that feature is available to you as well. And then United Healthcare Hearing. So those of you that have a hearing aid or may need a new hearing aid or a replacement, just know that there's a discount program through United Healthcare. And you can start with the 800 number listed here below, that 855-523-9355. Those folks will be able to help you, and that's our United Healthcare Hearing team. So they offer some great discounts on some very nice hearing aids. Again, they can be pretty pricey, so take advantage of this. Again, it's just an extension of your overall benefit package. And then the pharmacy benefits. So not really your benefits, but enhancements. So I want to, again, bring this, let you know about things that we're doing for you behind the scenes. So if you're taking a specialty medication and you're getting that medication through your pharmacy benefits through United Healthcare, you've probably heard this name before, Briova RX. So again, this is all coming down to a branding thing. You know, there's a lot of names within United Healthcare, and we want to make it as easy as possible for you folks. So starting January 1st, 2019, Briova RX will now be called Optum RX Specialty Pharmacy. Some of you who may be going through a chemo treatment, maybe you're getting your infusion sent to you or directly to your provider, and it's coming from Optum Infusion. So it'll be a continuous Optum Infusion Pharmacy. So again, trying to encompass all that and remove some of those names that you're like, who is this? So expiring prior authorization. Nothing more frustrating than thinking that you're going to go get your medication or it's going to be delivered to your home. Again, as I mentioned to you folks, and not only do I work at United Healthcare, but I'm a member, and I've had this happen to me, so I know it's frustrating. So I'm excited about this program rolling out. And this is all behind the scenes. So if you're taking the medication that requires an authorization and it's on file with us, and it happens to be coming up expiring soon, our pharmacy team will automatically reach out to your provider to say, hey, the member has 2 more prescription refills left. Is this a medication that they need to continue to take? The doctor will authorize it. We'll put in the authorization. No disruption for you. DX to RX. That's diagnosis to pharmacy. Okay? So this avoids prior authorization requirements by conducting real-time medical claim checks to automatically find a member's diagnosis in the claims history. So what does that mean? You can think of this maybe as Big Brother watching in a good way. So if you're a current member with United Healthcare, and I'm going to use cancer. So if you're going in and you're getting some chemo treatment, or we already know that there's some cancer claims on file, when an authorization comes in to prescribe a new medication related to that treatment, this is where this program comes into play. It's automatically going to be authorized because we already know that you're in treatment with a specific condition requiring that specific medication. So there's not going to be anything for your provider to do. We're actually doing that behind the scenes. And the 4th bullet point here, pre-check my script. We started that program earlier in the year. We're at about 50% of all of our contracted providers throughout the nation. So the pre-check my script, again, this is behind the scenes. So those providers that actually use electronic medical records, EMRs. I know my family doctor, he comes in, he has his laptop, he's just clicking away. He doesn't even write anything down anymore. It's wonderful. He can actually, since he's in the electronic medical records, he's looking at my medical records and also my prescription drug list and what medications are covered and not covered. What are the lower cost medications that may be available? For me as a consumer, that's important that my doctor is helping me not only prescribe the right medication, but making sure that I'm getting the most affordable medication. Okay, so that takes place behind the scenes. Again, those doctors that use electronic medical records, they have immediate access. They know if a prior authorization is needed, if they're prescribing something new. They know if something's not covered, if it is covered, or if we need to, like down here on this next slide, the step therapy. So there's a lot of commercials out there. You never realized you had that condition until you saw the commercial. So people run into the doctor's office, hey, I saw the commercial for this. Well, us consumers are paying for those commercials, so it's probably a very expensive medication. So we have the step therapy program. That's also part of the, as I mentioned, that pre-check my script. So your provider is going to know if there's a step therapy. So instead of you getting the $4,000 medication, there may be a $200 medication out there that's going to do the exact same thing for you. Now, I realize all conditions are not the same. The way people react to medications are not. You folks have been with us for a very long time at United Healthcare. You probably haven't been caught up in the step therapy issue. But again, if you do and you need to speak with a doctor or nurse, know that we're available to you, just calling that 800 number. But again, most of this takes place behind the scenes. So if you are prescribed a medication and it's not working, that's a conversation you need to have with your doctor. And if the most expensive medication is the one that's working for you, again, that's what you're paying for insurance for. But we do have the step therapy program to help manage costs for you and your employer mission. I'm going to go back up to the top, prior authorization. We talked a little about that, just what that means, that it does require authorization on specific medications, not all of them. There are supply limits, and those limits are set by the FDA. My final slide here in conclusion, wanted to focus a little bit on this just because there's, either you're affected by cancer or somebody who is, it's just a shame, but there are a lot of things taking place behind the scenes with chemotherapy, drugs, and treatments and the prior authorization process. So again, when I mentioned some of the programs we're doing behind the scenes, diagnosis to RX, this is one of them. Okay, so last thing we want for you as a cancer patient or your spouse that you're covering, maybe they're going through chemo treatment, is for you to be disrupted and have another thing to worry about, trying to get authorization and worry about, am I going to get my medication on time and my treatment? So if you ever have any questions, need help maneuvering through the healthcare system, you have the you have customer service available to you. You have nurses available to you 24/7, and also our virtual doctors. All right. And final thought here, part of an extension of your vision package is Warby Parker. I've seen those commercials on TV. You may have as well. And you actually will need a prescription for, obviously, new glasses and lenses. But Warby Parker, they do have some retail stores, and you can see on the slide presentation here. You can check at myuhc.com or myuhcvision.com. You can call Warby Parker Direct, or you can call United Healthcare Customer Service. But you do have vision benefits with us that cover lenses and frames. And they will send you 5 samples in the mail for you to try. You pick the one you want, you send it back, and then they will fill your prescription and send you the selection that you've chosen. So again, as I mentioned, some of them have retail stores, but most of it is done through the mail. So this is just an extension of your vision benefits. All right, and I'm going to turn it back over to Joe, and he's going to wrap it up for us here.
Thank you, Patrick. So on the slide you're looking at right now is our flexible spending accounts. So for this plan year, the healthcare reimbursement has a limit of $2,700, and that's governed by the IRS. And for dependent care, it's at $5,000 annually for a couple that's married and filing jointly. We suspect that the healthcare reimbursement annual amount may increase for 2020. In the past, it's been increased by $50, so it may go up. And if it does go up, we will be sure to have that new amount uploaded into SmartBen when you make your elections. One other thing is just keep in mind that the best practice is anytime you see a doctor, anytime you get a prescription filled, it's always wise to keep the receipt in case BPAS sends you an email or sends you correspondence requiring that you provide the receipt. You would need to do that. It's very easy. You can just go to the BPAS website, log in with your credentials, upload the receipt, and you're done. For those of you that are currently participants in the flexible spending account and have an active Benny card, the Benny card is just like any other credit card. It has an expiration date. So if you re-enroll and your current Benny card is still valid, you will continue to use that card. If that card is about to expire or will be expiring, then BPAS will automatically send you a new card. So please don't destroy your current Benny card because it more than likely is still valid. We put up a slide now on Fidelity, our 401k record keeper, and I put it up there because, as you know, the 401k plan is an ERISA plan and is governed by ERISA. So it's always a good practice at annual enrollment to review your beneficiaries. So if you want to adjust the beneficiary for your 401k program, then you would reach out to Fidelity via a telephone call, or you can go to their website and actually log in and update or change your beneficiaries. It's very important to note that your beneficiary that you have selected for your company-paid life insurance, that beneficiary does not carry over to your 401k program, so therefore you should at least annually review your 401k beneficiary designations as well. So the company provides eligible full-time employees with two times your annual salary, up to a maximum of $500,000 of basic group term life and accidental insurance. You can also buy additional insurance if you want. So you can purchase for your spouse up to 100% of the employee coverage amount in $5,000 increments up to a maximum of $250,000. If you make an election over $25,000, it will require the evidence of insurability, and that will be subject to approval by UNUM. You can also purchase insurance for children or dependents. Those are in increments of $2,000 up to a maximum of $10,000, and this is for children up to the age of 26. Some things to keep in mind when making your supplemental life or AD&D insurance elections are: you must select coverage for yourself before you're eligible to purchase insurance for your spouse or your children. And your supplemental life and AD&D coverage elections are separate than you normally would, than the actual amounts. I think we want to thank you so much for participating on our call today. If you have any questions at all, please send an email to npcbenefitsadmissionform.com. And if you would, on the subject line, if it's for UHC, please put UHC on the subject line. And then that way we know that if we can't answer your question, we'll make sure to reach out to Patrick and his team to get you an answer as quickly as possible.